Had I known about this, had I done this from the beginning, I think I could have saved myself 3 years of hell and a great deal of financial pain. It's hard to explain because, like I say, by the time it got to you, I was so beaten down and my expectations were so low. It was hard to even disappoint me because I was just not expecting much. It was never any offense to you. It was just one of those things, when everybody tells you the same spiel about how, oh, I've been doing this for 30 years and I've seen everybody get better. And then you're the one person, when they tell you, oh, I get 95% of my patients heal and never go back. And I'm the one that goes back. And so I have been very pleasantly surprised to find that it actually has helped me. It's been a journey, but I'm thrilled, beyond thrilled, that this really has helped.
Hello. Are you or a loved one suffering from a debilitating chronic illness, an invisible illness that your doctors, your hospitals, your alternative doctors have not been able to figure out for you? If you are one of millions of people who are suffering from a terrible, crippling, debilitating, painful disorder, you deserve to hear what this wonderful woman, Amanda, a patient of mine, my name is Dr. Lonnie Herman, and Amanda's going to tell you how finally, after 3 long years of suffering with 52 different symptoms, 52 symptoms, how now she has finally found relief from this unique care that I offer in my Rapid Health Restoration System. So if you're, again, one of millions of people out there suffering with taking medications, taking antibiotics, taking different types of alternative treatments with herbs or different types of machines that practitioners are using for you, and you're seeing very little, maybe you've had some relief, maybe you've plateaued and you still can't get past that plateau, or maybe you're seeing 0 results with everything that's been offered to you to try to help you fix yourself, you deserve to hear what Amanda is going to tell you, because she, now finally after 3 long years, she's feeling about 75% better. Many of these 52 symptoms have completely disappeared. So let's take a break for a moment. We're going to hear what she has to say. And after we come back from her, I'm going to share with you what I found with her that we treated for her in this unique system that I work with, that I practice with people. And then I'm going to make you a free offer of how you can become a patient here in my clinic. And yes, this video is about you becoming a patient here in my clinic for me to help you make a difference in your life, for you and your family and your friends. So let's hear what she's got to say, and I'll be back in just a moment. You presented me with a list of 52 symptoms, right?
Yeah.
52 of them, and it was horrible.
Yes, it was rough. I couldn't tell you how many doctors locally around here, primary care doctors, urgent care doctors, over all of the course of 3 years. I think I was in the ER 9 times. It got to the point where they just started kind of rolling their eyes and saying, well, she's crazy. She's a hypochondriac. I was told my best bet was to go seek a psychiatrist because it was probably some sort of a mental issue I was having, that there was nothing physically wrong with me. My blood work looked fine, that everything was fine. And I could not have been more convinced that they were wrong. I was physically so fatigued. I could barely move, could barely get off the couch. I couldn't play with my kids. I couldn't do anything. I could barely stand up and walk. I would go from being super weak all over to having tremors and shaking violently to having excruciating pain all over. I would have horrific migraines that would last 12 hours or more and nothing would relieve them. I had horrendous brain fog. I couldn't remember anything. By the time I found you, I was literally convinced that I was probably going to die. Even some of the alternative doctors were looking at me and going, we don't really know what else to do for you. I was officially diagnosed with Lyme disease very beginning when I started this. And, because I talked to you, I was very concerned that, because I didn't see immediate relief from symptoms for a while when I started the remedies. I had gotten to the point where I felt like I'd been so burned by so many different programs that it was like everybody told me they were going to fix me and nobody did. And by the beginning of November, I was starting to feel significantly better, where a large portion of those symptoms were either gone, or I was feeling them far less frequent. And when they would show up, they would be much less severe.
How much better would you say you are now compared to then?
I would say now I'm probably about 75% better overall, just with absolutely everything. There are a handful of symptoms that are just pretty much completely gone. If they crop up, they're really small and I barely notice them. They're not anything like the life-altering, earth-shattering symptoms that they were before. I'm back on with you and started a 4th round this past Tuesday. I've still had issues, but have felt significantly better. I've had some energy. I've had far fewer symptoms than I'd experienced before. So it's definitely better.
Yeah.
So I'm looking forward to this 4th round to see how much better
it's going to be awesome. I mean, what we found in this recent exam is just incredible. The internal shaking, you told me, was pretty much gone.
Yeah.
Yeah. You told me that your dizziness that you had all the time is now rare, and it was constant, right? It's now rare if ever.
Yes.
The ear ringing, or tinnitus, as it's called, that's the frequency is down greatly, right?
Yes.
Your anxiety that you had, is gone.
Yeah, I wouldn't say it's 100% gone, but I would say that's at least 95% better. Every once in a while, I'll get a little bit of flare up of that, but that right there is miraculous in itself, because I've had chronic anxiety my entire life before any of the rest of this even started. And I have not had any kind of a panic attack. I have not had any kind of severe anxiety, anything in, months and months. Yeah, it's been a very long time.
Awesome. And that was definitely one of them when you came to me back in September of last year.
Bad.
And that's been for how many years was anxiety? How many years would you say, going back, if you can remember?
I would say going back to childhood, that it's been there to some extent, getting worse and worse as the years go on and stress becomes, more severe as you become an adult. But yeah, it's been there. It's been with me my entire life. It's been very, very severe.
It's going to be 100% gone.
Yeah.
That's awesome. You had nerve pain all over your body.
Yes.
You told me it was gone.
Yes. Yeah. I get little bitty flare-ups of that, maybe like in my feet, just a little bit here and there, but it's nothing like, I literally couldn't walk. It would hurt so badly, and my feet would go numb, and the tingling and the pins and needles and everything, almost 100% gone.
If you wouldn't mind, if I can share each one of those 52 symptoms when I make another video about this. Okay. And if you wouldn't mind that I share the exam findings of what I discovered, of what's gotten you your life back.
Number one, don't give up, because it's really, really tempting to give up, because you really want to. At a certain point, you feel like I felt like I had tried everything. There was nothing left. Number two, this particular method does feel weird. It does feel too good to be true.
Hope your husband is pretty happy he's got your back.
Oh, yeah.
Are happy that your children have you back. And there's just a little bit more, but you're going to be fine. So again,
and I'm happy. I'll listen to your video, because I don't even remember all 52.
Yeah.
I'm so far removed from it. I can't remember all of them now at this point. But yeah, there were a lot.
Well, isn't that just incredible? 52 symptoms, 3 years of suffering. She went to hospitals. You heard her say hospitals. She's now better. She went to different alternative care practitioners. She and her husband told me that they had spent over $100,000 in alternative care. That's after multiple visits to the emergency room and multiple different doctors, medical, in the hospitals, could not help her find relief. $100,000 extra of her own dollars spent on that. She told me there were no more good days anymore. She felt like she was one in a million who could never get better. So she feels like she's an anomaly, is what she told me when I first met with her. I'm going to go over what these symptoms were first, all of them. I'm going to read off all 52 symptoms to you, and then I'm going to get into the findings, some of these unique exam findings, and I'll make it that free offer that I mentioned a few minutes ago. I'll look forward to helping you get better, because just like she has, I've got dozens of testimonials here on my YouTube channel, on my website, where you'll just see people and hear people talking about their incredible recovery with my unique work. And it's really important for you to see more people from real life who have helped them to make such an incredible change, relieving their symptoms by getting rid of the hidden causes of their condition, their unique hidden causes to their own individual condition. People getting better from fibromyalgia, people getting better from shaking, tremor disorders, people getting better from stiffness, rigidity disorders, from weakness, from asthma, from skin rashes. The list goes on. So yes, I can help many different people with many different types of symptoms, and this is reality. You'll take a look at my website. We'll get into that free offer in just a few minutes. She had, number one, heart palpitations. She had low blood pressure. The bottom number was sometimes in the 50s. Her blood pressure was on average 80/50. That was her average. She felt like her heart was beating across her whole body. She could even see the pulse inside her eyes, and that was a constant problem. She had constant fatigue. Sometimes it was overwhelming, she said. She was completely exhausted with any exertion, just like bending over to take some clothes out of the dryer. For literally, she would feel exhausted for that. Dizzy, every day dizzy. She was feeling like she was suddenly being tipped over, or a rug was being pulled from under her. She had pressure in her head. She had pressure behind her eyes. She had a clicking and ringing in her ears, or a tinnitus in her ears. She had a temporary loss of hearing in one of her ears. She felt like her ears were going to explode from the inside. Her brain fog was terrible. She was forgetful, poor memory and recall. That was constant for her. She had trouble concentrating, especially when reading, trouble concentrating. She had internal vibration. She had a constant internal vibration from the bottom of her feet, tingling up her legs into her hands. She had nerve pain, sometimes all over her entire body. She had pain and heaviness in her legs and feet, widespread pain that moved around her whole entire body. She had tightness and tremors in her mouth and her jaw. Slurring of words, feeling like her tongue didn't work sometimes. I'll pause there. She actually was afraid that she was going to be diagnosed with ALS or MS. And she had done they had done MRIs. There were multiple studies that were done. That was never a definitive diagnosis that the doctors ever gave her. But because she started slurring and losing ability to speak at times, that she thought it was ALS or MS. She had intense dry eyes and eye pain, irritation and burning in her eyes. That was daily. She had severe eye floaters. She had blurry vision every day. She had pain behind her eyes. She had nausea that was constant, upper abdominal pain, tightness in her chest, heaviness in her chest, carpal tunnel-like pains in her hands and her arms, muscle twitching, daily muscle twitching, especially in her legs. She had severe jerking in her body every night. She had very heavy periods with very heavy or a lot of clotting. She had pain during ovulation. She had severe breast pain and soreness with swelling. She had a very low sex drive. She had clicking, popping in her joints constantly. She had debilitating joint pain in her knees and her ankles. That would come and go, but pretty constant. When I mean come and go, it wasn't 24/7, but it was every day, on and off. She had constipation every day. She had insomnia. That was terrible. She could not sleep. She had trouble falling asleep. So insomnia was trouble falling asleep, but also staying asleep was very hard for her. She had itching that was all over the body that she seemed to have no rhyme or reason for why her body would itch, and there was no rash. She was irritable, easily frustrated. She had thinning hair. She had a blood sugar dysregulation problem. She had dry skin for her entire life. She had some clogged pores, oily skin, some breakouts. Her nails would break off every month around her cycle. Her nails would just break off. She had, of course, some hair growth on her chin and her face. She had night sweats, burning in her feet, shortness of breath every single day. She was feeling like she was being squeezed to death all over her body. She had anxiety that came and went. She had depression from feeling so sick for so long that physicians couldn't help her. And she had a low-grade fever most of her time. Those are the symptoms that we were up against to get her relief from. And now, as you heard her say in her discussion or that brief interview, which you're going to see the whole testimonial video at the very end of this video presentation, by the way, I'll tell you that it was not simple to get her to feel better, but she heart palpitations are almost completely gone. The dizziness, which was constant, is extremely rare. The internal shaking is pretty much gone. Her sleep is better. Her periods are better. She has no more weakness. The ear ringing has decreased dramatically. The brain fog is cut by 50%. And that was on April 18th. I got that from her, brain fog down by 50%. It's even better now in her fourth protocol, her fourth customized protocol that I developed for her. Anxiety was gone. The nerve pain over the whole body was gone. The tingling in her body was gone. The breast pain that was always there is gone, except for during her cycle, which that'll be gone too. She does not anymore feel like she's being squeezed to death. The shortness of breath is great reduction in severity and frequency of the shortness of breath. Her tongue tremors are gone. The body tremor is gone. So I'm going to share with you between September 21st of 2022, when I first examined her, to December 16th of 2022, her second examination and second consultation with me, to February 8th of 2023 for her third exam, and April 18th was her fourth examination, April 18th of 2023. And I'll just tell you, just to start off, how do I do this? How do I figure things out for people? And you're going to hear some very unique exam findings that you probably have never heard from your doctors before. And so when you hear these exam findings, I'm telling you, I've developed over the years, a very unique exam system and a very unique exam process that helps me figure things out. It's like literally inspecting in specific tissues of the human body, which hidden infections are causing the debilitating symptoms that people are suffering from, and which toxins are in the tissues that are causing these debilitating symptoms. There are 5 different senses that we have that we can use in the exam process. We have sense of vision, we have sense of hearing, we have sense of taste, we have sense of smell, we have sense of touch. And we also have, let me add to that, we've got emotional stresses. You'll see a page on my website about the emotional restoration process that I do here, because people can have emotional scars from previous experiences with family members, or a low self-esteem, or they were literally abused as a child, or in an abusive relationship as an adult, and there's many others. So without getting all deep into that, there are many different exam processes that I've developed, or exam strategies or methods that I've developed in this method that I've created here to find why is the person weak, why is the person stressed, why is that person diseased, and then we provide these safe and effective, highly effective quantum energized formulas that help a person target exactly the specific infection that's in the specific organ or part of the brain or bone or lymph or muscle or gland or blood vessel, really, to help target that specific organism that's causing them their symptoms. And once the organism and or the toxin is rid from the body, the symptoms just lift. They're alleviated and life is restored to normal, whether that's in one treatment, which I hope it is, or 2 treatments, which I hope it would be 2, if not just 1. Maybe it takes 3, maybe it takes 4. I don't know how many pieces of the puzzle you have in your body, but we're going to figure it out for you. But you're going to hear some of these details right now about Amanda's exams. So in September, and she came back after her September examination in December, and she had 0 relief from her symptoms. But now she's 75% better. So what did I find with her? I found that there was black mold, Stachybotrys black mold affecting her brain, black mold affecting her lungs, Lyme disease infections in all of her connective tissues, parasitic infections in all of her connective tissues. She had the epidural chemical that was provided her in one of her children. When one of her children was born, the epidural was affecting her heart. She had the measles virus and black mold affecting the ureters, which are the tubes that come out of the kidneys to bring the urine down to the bladder. She had the epidural that was given many years ago in her kidneys, affecting all parts of the brain and the body. She had mold toxins or mycotoxins, many of them affecting her brain. She had the epidural affecting her brain. She had influenza virus affecting her heart. She had antibiotic residues that were left over after using antibiotics to try to kill Lyme and other infections that doctors had found. Those antibiotics, actually residues of the antibiotics, were left over in her liver, causing her more problems. The small intestine was affected by the epidural, her stomach and her spleen, and her spinal cord affected by what's called dengue fever virus. She also had the influenza virus affecting her cerebral spinal fluid and bacteria infections in her sinuses. She completed that protocol and came back to my clinic with zero relief from her symptoms. Yet, when I re-examined her, those infections, I was able to discover those infections were gone from those tissues that we found that I just listed for you. So we moved forward with more examination process to keep finding the pieces of the puzzle. What I don't know for you, think of this. If you really love putting puzzles together with puzzle pieces you put together, and you love the Statue of Liberty, we're going to use the Statue of Liberty to liberate you from your disease here. But you love the Statue of Liberty, you go to a hobby store, you find 2 boxes from 2 different companies. One's the ABC Puzzle Company, and one is the XYZ Puzzle Company. They're both going to be a 3-foot by 5-foot picture of the Statue of Liberty when you're done putting them together. They're both identical pictures when you complete the puzzles from both different puzzle companies. The only difference is the ABC Puzzle Company has only 10 big pieces of a puzzle you put together to make that 3-foot by 5-foot puzzle at the Statue of Liberty. The XYZ Puzzle Company has 500 pieces that you put together to make the same 3-foot by 5-foot picture as the ABC Puzzle Company. 10 pieces in one puzzle, 500 pieces in another puzzle. It's going to take you a lot longer to put together 500 pieces than a 10-piece puzzle. You understand? So you could have multiple different infections and multiple different toxins in your very chronic invisible illness, your very chronic painful illness that have invaded different tissues of the brain and the body all at the same time. And your body may not be strong enough to rid all of those infections and chemicals from the different tissues where they've become deeply embedded in. And you, even though you put together, let's say, 100 pieces of that 500-piece puzzle, you may not really see the whole picture yet. You may not feel the relief yet. You still can't feel better yet until you start to put more pieces of the puzzle together, or in other words, get rid of more of the hidden infections and chemicals, and we can find them and help you do it safely and effectively without drugs. In her second exam in December 16th of 2022, I found the influenza virus affecting the nerves, the coronary plexus, the nerves that go to the heart. I found the influenza virus in her kidneys. I found that she was affected by the recent, let's just say the injection, I don't want to use a specific word here, but the injection that's been given to people over the past couple of years, right? That affecting the heart, affecting blood vessels in the brain. It was affecting her kidneys. It was affecting the whole brain. And that was part of why she was suffering with these symptoms, but it didn't start the symptoms off, but it was added more fuel to the whole fire. I also found that there was mercury in the brain and the white matter of the brain and spinal cord, as well as those other shots that we're talking about, if you know what I mean, in her lymphatic system. So in December, when she took that first remedy for the mercury to come out of the brain, you hear her talk about in the testimonial, the shaking in the body within 20 minutes of taking that specific formula, the shaking in the body and the mouth and the jaw and the tongue and everything, it stopped instantly. Pretty amazing. I decided when I saw her in February to do another kind of exam with her, another method of examination. I noticed she was convinced for a long time that using certain organic, I'm not knocking this method of cleaning the house, but using certain organic type or chemical-free detergents and counter cleaners was the right thing for her. I found out that the actual aromas of them were bothering her. She didn't realize it. I found out that the essential oils that she believed were good for trying to relieve a headache or for a sore throat or whatever else that she was using these for, I actually found that those aromas were also hurting her terribly. And I found in this third exam, which really made the biggest difference, her third exam from February of 2023, I found that she had Bartonella henselae in her brain. I found she had a Bartonella aeropensis bacteria affecting her brain. I found that she had Bartonella aeropensis affecting her bones and her lymph and blood vessels. I found that she had the Bartonella henselae affecting the conductor of the heart, or the AV node on the heart. She had that same Bartonella affecting her stomach. She had the Bartonella affecting the olfactory nerve, which brings the signal of the aroma to the brain, where memory is as well in the brain. I found she had residues of a famous cheeseburger. I won't mention the chain. I'm not here to slander any company, but the chemicals of a very fake food that's out there in the fast food market that she hadn't had for many years. The chemicals in that fake hamburger were in her brain. When she came back to me after following this third protocol for her fourth exam, she walked in with a smile into my clinic, and she told me she had significant reduction in symptoms, significant reduction in some of these symptoms of the 52 symptoms I read off to you in the beginning of this video. They were gone, completely relieved after following that third protocol. And a lot of the other symptoms in the 52 symptom list of symptoms had greatly decreased in their severity and their frequency, which is phenomenal. So I saw her in April, and you hear her talk about in her video testimonial, the first week when she started following this fourth protocol, within the first week, she went from a 50% improvement to a 75% improvement, dramatic. I found in this fourth exam, she had another strain of the Bartonella called Bartonella washoensis, Bartonella bacteria affecting her brain. She had the Bartonella washoensis affecting her lymph. She had graphene oxide affecting her brain. She had acetone, which is from nail polish remover. The acetone was in her lungs. Not that she drank it or tried to sniff it, but just going to get your nails done, ladies or gentlemen who get, manicure, smelling those chemicals of a acetone nail polish remover does absorb into the lungs and into the brain and the body. And that's one of the reasons why some people are sick or have headaches or have back pain or feel fatigued or have asthma or shortness of breath. I also found the Bartonella bacteria in her lungs. I found the graphene oxide, very toxic, very bad chemical affecting her kidneys. I found another type of Borrelia called Borrelia racurrensis affecting her brain. She had the graphene oxide in her sinuses, Bartonella washoensis affecting her heart, massive fungal infections affecting her breast tissues internally. She had Epstein-Barr virus affecting her tongue. She had mold affecting the skin. She had arsenic and influenza affecting the kidneys. She had multiple childhood vaccines affecting her kidneys, chlorine from the water she drank for years affecting the kidneys. She had Lyme infection infecting and affecting her joints, parasitic infections affecting her joints. And finally, she had a fungal infection that got deep inside a part of the brain here that's just below the cap of the skull called the cortex of the brain. And the cortex of the brain helps to control every single sensation in your body and motor control of organs and limbs and tongue and eyes. The cortex is involved in everything. So when there is an infection that's in the cortex that creeped up there throughout the years, that migrates through the blood up into the brain, what happens to that part of the brain's ability to control a limb or an organ or the tongue or so on? It decreases its ability to control the organ or the limb. And then we have symptoms, whether it's numbness or tingling or pain or weakness. That comes from that. So that's everything I'm going to share with you about her unique exam findings here. And hopefully it's helping to inspire you to realize that what you have done with your physicians may not be good enough to help you get better. Even if you're trying other methods right now that seem to give you a little, bit better by using a certain supplement or a certain diet, unless you can rid the unique specific causes that are in your brain, in your body, unless you can find them and literally rid them safely and effectively without drugs and without any harmful side effects to a herb or some other type of supplement or medication, unless you can do that, you may never really get past this plateau that you're at right now. So with that said, go back and listen to this video and listen to those unique exam findings again. And even look at other testimonials and other descriptions I've provided you in these other videos here on my YouTube channel, on my website, on Facebook. And you're gonna start to see from a whole different point of view of what really, really has to be dealt with and what really has to be done to figure why you're suffering terribly from the chronic disease and help you finally find relief. And that can be done. And it's my pleasure to do it for you. We see people in my clinic here. Right now I'm in Southeast Florida. People come to my clinic from other states within the United States. People come to my clinic here in Southeast Florida from other parts of Florida. Really, people also come to my clinic from other countries, Ireland, New Zealand, from Portugal, from United Kingdom, from Canada, from Mexico, from Australia, from Israel, from other parts of the world, because once they start to get better and they tell their friends and family and neighbors, those people come as well. And it's my great pleasure to do this work. So the free offer that I want to make for you on my website, you can download your free copy of my ebook about how you can rapidly reverse the symptoms from your chronic illness with quantum energized medicine. All right. And you can download that book instantly for free. Read the book. It might take you 1 hour at maximum to read through this book. You're going to see there's big font, big pictures, and links to other pages on my website. One page I'm going to recommend that you'll see is for the food exam that I do, a very unique food exam. It's not about a food allergy to gluten or dairy. It's about the infections in your body that make you have these reactions to the foods. And when we can find those infections and help you rid them safely and effectively from your body, then you don't have the reaction to that food anymore. You're going to click on another page on my website, that on this book that brings you to another page on my website, about my dental examination, my understanding how the teeth are linked to many different diseases in the brain and the body. That doesn't mean you have to get all your teeth pulled, but you can have infections underneath crowns. You can have fillings in your teeth that are just bad. You can have infections in a tooth that don't even show up on an x-ray. So look at the dental page. On the last page of my website, there's a link that will take you to a private page of my website to help you understand a video that I did that you can watch. It's 42 minutes in length. I take you through my journey as a physician to become the doctor who can help you get yourself or your family member better from the chronic illness, whether it's chronic fatigue, or whether it's a tremor disorder, or whether it's a chronic migraine, or whether it's a chronic pain, or a rash, or an asthma. Digestive problem, it can be done, and it will be done for you. Now, you watch that video, I take you through my journey, and as well as I give you some brief insight into the type of unique exam process I do. Watch that video. It's going to help you to understand on a whole different level, a quantum level, of what is going on with your body and how you can begin to get yourself out of this chronic illness situation that you're in and get your life back. All right. So take advantage of that information. And finally, you can make an appointment with me in my clinic through my clinic assistant or through my website. So we have a book appointment page on the website that you can click on. It's very easy to go to. Click calendar there, book your appointment. You'll see all the steps that we lead you through and make everything transparent about your investment cost here, our location, the hotels near us, as well as the airport to fly into. It's very easy to do. Very easy to do. If it's too difficult for you on the website, call my clinic. My assistant will help you through all of that information. You can call my clinic at 954-370-3100. That's 954-370-3100. Or send an email to my clinic at clinic@drlonnieherman.com. That's all up here on the video for you to copy down. And now what we're going to do, I'm done speaking with you about everything that I've done for this woman, and we will have a follow-up video in the future when she's 100% better to share with you. Now we can shift to another video where you'll hear her talking about all of what she's been through and how much better she is and how remarkable it is. I look forward to helping you. You can get your life back. The time is now. There is no tomorrow. The time is now. Let's take advantage of the time that we have together and help you get your life back. See you soon. Hello, I'm Dr. Lonnie Herman, and I'm with a great patient of my clinic. Her name is Amanda. She lives a few hours north of where my clinic is here in Southeast Florida. And she came to my clinic sometime in 2022. Right now, we are May 5th, 2023. And she had a very long list of severe symptoms that were debilitating symptoms and suffering terribly. And right now we are after 3 protocols, 3 unique exams and 3 unique customized treatments for her, natural, very effective and very safe treatments. She has significant reduction in the symptoms, and she's happy to get on this call with us to be able to share with you all who are suffering or have a family or friend or neighbor who's suffering terribly with a debilitating condition.
that you can get better, and there is a way, and there is a way out of the horrible life of severe symptoms of pain and heart palpitations and feeling like you've gone to different doctors who haven't helped you, and hoping that you can get answers. And here we are with, and I'm really impressive about 75% reduction in these horrible symptoms that you suffered, but she'll tell you more about that. So Amanda, I thank you for getting on this call and sharing. You're generous to share your time and your personal, life with people out there who, like you were, who are still suffering and hoping that they could find someone who can help them get out of that miserable situation.
No,
And
it's
if I
my
could
pleasure.
just say, thank you. Yes. I remember, and we'll make this very short. And I appreciate you getting on this call with us and let you go back to your family. I remember when we first started speaking about your condition, when you contacted me, because I think you found me online through, yeah, right. Okay. And you had already been to different physicians, and you had a very long list as I opened up this discussion, that when I was writing notes as we consulted about your condition, I kept writing and writing and writing of all the symptoms you had. And I asked you if you could do me a favor to actually take some time on your own and print up or jot down notes of all those different symptoms and bring them with you to your first exam appointment. And then I'd sit with you for about a half hour or so, or an hour, however long it took, to understand the severity of those symptoms, the frequency of the symptoms, how long they had been, if there were any triggers that made them worse or bring them on. And you presented me with a list of 52 symptoms, right?
Yeah.
52 of them, and it was horrible.
Yes.
And I'm going to make another video. I don't have to share every single of the 52 right now, but all those symptoms were really bad. And I do recall in the first two exams, the first two protocols, your discussion with me, you called me a couple of times, more than a couple of times maybe, but and it's okay, and I'm here for you, and I'm glad that we're getting the results that we're getting for you. But you were so scared that you thought you were developing like MS or Lou Gehrig's disease or ALS, whereas you were fearful of that. And it got to the point where you're a very young woman, you're young, you look like you should be healthy, but suffering internally. You have 3 beautiful children, you've got a husband, you've got a loving family, but you got to the point where you couldn't even walk sometimes. You were telling me your husband had to pick you up and carry you, right? So it was very bad. Is there anything that, without me getting into, and I could get into these different symptoms, would you like to just come out and share with people what it was like for you to live, and what it was like with the different physicians, or what type of treatments? We don't have to name any physicians' names,
Sure.
But any type of treatment that you did that just didn't work for you. And then we'll talk about this work.
Yeah, it was rough. It started at the end of 2019, and I had always had some odd physical symptoms off and on for years, and everybody just chalked it up to stress, anxiety, whatever. And then, but overall, I thought I was pretty healthy. I have 2 little girls. And then in 2019, I got what I thought was the flu, went to urgent care. They put me on a steroid, which I'd never had before, and everything just exploded. And from that point forward, I just went rapidly downhill. And no one could tell me why. I couldn't tell you how many doctors locally around here, primary care doctors, urgent care doctors, over all of the course of 3 years. I think I was in the ER 9 times. And every single time they would run a battery of tests and basically come in, and it got to the point where they just started kind of rolling their eyes and saying, well, she's crazy, she's a hypochondriac. I was told my best bet was to go seek a psychiatrist, because it was probably some sort of a mental issue I was having, that there was nothing physically wrong with me. My blood work looked fine, that everything was fine. And I could not have been more convinced that they were wrong. I was physically so fatigued. I could barely move, could barely get off the couch. I couldn't play with my kids. I couldn't do anything. I could barely stand up and walk. I would go from being super weak all over to having tremors and shaking violently to having excruciating pain all over. I would have horrific migraines that would last 12 hours or more, and nothing would relieve them. I had horrendous brain fog. I couldn't remember anything. It was just terrible. And then, like you said, the heart palpitations started. Actually, after I got COVID, in 2022 is when the heart palpitations kicked up all of a sudden out of nowhere. And my primary care doctor at the time told me, oh, it's just long COVID. It could take a year, but eventually you'll heal and that'll go away. But there's nothing we can do about it. But yeah, by the time I found you, I was literally convinced that I was probably going to die because there was nothing. I had seen multiple mainstream doctors. I had seen quite a few alternative physicians. And although some of the alternative therapies would seem to help for a while, slowly but surely, as time would go on, I would sort of relapse and everything would come back on. And at first it wouldn't be so bad and it would just get progressively worse and worse and worse. And it just seemed like, even some of the alternative doctors were looking at me and going, we don't really know what else to do for you. I was officially diagnosed with Lyme disease I was told by a natural physician in the end of August of 2020 that it was Lyme disease, which I had suspected. He determined that through muscle testing. And then I was actually given a lab test by a different alternative doctor in January of 2021 that came up with Borrelia, which is Lyme, and Bartonella, which is a co-infection of Lyme. And from that point on, I mean, everything I've done, sauna treatments and ozone treatments and IV vitamins. And I mean, just the 𝐊𝐵 therapy, the hyperbaric oxygen therapy, PEMF therapy. And again, I have a lot of those devices at home that I purchased along the way to try to help me. And they would kind of, I guess, in my mind, they kept me alive. They kept me here, but they weren't fixing me. They were helping me not die, but I really got minimal relief from those things. And it would continue and to fluctuate to the point where I would have a week of feeling like I'm starting to feel better. And then all of a sudden it would just crash back down. And I would think, this is never going to go away. And I found you through a random internet search looking for help with Lyme disease. And I still tell my husband it was some kind of a miracle because I don't even remember what I searched and I have no idea how your name came up. I turned around the next day and tried to search it again and it didn't come up. So I just felt like it was the right place at the right time and immediately read the website, watched every video you had. And I called Sergine and made the appointment that exact same day, like within an hour of finding you. And haven't looked back.
Excellent. And, but you were, when we first spoke, you were pretty fearful, like you, and I remember hearing it more than once, are you that one in a million who just can't get better? Right. And that was troubling you because you tried a lot of different things, as you've already said. With the difference in when you mentioned a couple of times now that you had done some different treatments that seemed to be helping you or keep you alive and symptoms had reduced. I don't remember if you said the severity of the symptom reduced or the frequency or the severity and the frequency of a symptom like a migraine or a heart palpitation or the pain or so. What when they reduced and they would come back with a vengeance, if you will, a week later, what's the difference of that experience of feeling like something was making a difference in your life and reducing these symptoms to what you're feeling now?
Well, I will say, just to be, completely honest, in the very beginning, when I started this, I was very, and, because I talked to you, I was very concerned that, because I didn't see immediate relief from symptoms for a while when I started the remedies. Everything kind of felt like, this is going to be another one of those things. And I had gotten to the point where I felt like I'd been so burned by so many different programs that it was like everybody told me they were going to fix me and nobody did. And so when I first started and I didn't see some sort of instantaneous miracle, I thought, well, here we go again. This is going to be the same thing. And it was probably beginning of November. I think I came to you, was it August or September? I can't remember now. And by the beginning of November, I was starting to feel significantly better, where a large portion of those symptoms were either gone or I was feeling them far less frequent. And when they would show up, they would be much less severe. I had several weeks at the beginning of November, and I thought, wow, this is great. This is actually going to work. I'm going to get better. My husband and I went on vacation, went out of town. And I think after talking to you, I had some exposure to potentially some COVID, maybe some COVID vaccine. I'm not sure. But either way, when I came home, started to feel really bad again. And that was, about the third week of November. And it kind of just went really downhill. And I called you and we sort of had an emergency consultation in December. And you kind of relooked at everything, retested me. We started treating again. And at that point, again, whatever I had been exposed to, it felt like it combined with whatever was in my system. And that's when the worst of the neurological symptoms really started. I was having a lot of like weird tremors in my head and my face, a lot of shaking, vibrating, dizziness, involuntary muscle movements. I mean, just really frightening things. That was the first time I clearly remember. And honestly, I'm not 100% sure. I think it was a remedy for the brain and mercury that I took in December that I was feeling so bad, and nothing up until that point, I just wasn't getting any relief, even with the new protocol. And I was laying in bed and I was miserable. And I thought, what have I got to lose? It was not for a week or so that I was supposed to take it. But in my head, I just felt like, go take that remedy. And I got up and I took one. And I do believe it was mercury in my brain. And I took it. And probably within 20 minutes, all that vibrating, shaking in my head stopped. The tremors, I was having really bad tremors in my mouth and my tongue and shaking really bad. And it just left. I slept through the night for the first time in a really long time at that point. And now it didn't all go away. Some of it cropped back up a little bit, and we've sort of knocked it down as it's come back up. But that was the first time when I was like, it was an immediate result with it that I thought, okay, maybe this is doing something that I haven't realized it's doing before. And from that point on, there's been a couple more like that where I was suffering with something and got to the remedy, and it was noticeable very quickly. And it's gotten better and better until the last 2 weeks. And really, I've been off. I restarted my fourth round. I'm back on with you and started a fourth round this past Tuesday, and have been off of all remedies for a month while I was waiting to see you and getting the remedies in the mail and all that stuff. I've still had issues, but have felt significantly better. I've had some energy. I've had far fewer symptoms than I'd experienced before. So it's definitely better.
Yeah.
So I'm looking forward to this fourth round to see how much
it's
better
going to be
gets.
awesome. I mean, what we found in this recent exam is just incredible. And with the method that we found, it is just incredible. But the difference between the symptoms, the slight reduction for, let's say, a week before and now, but before you ever came to me, I'm talking about with the other methods that you used and you realized that they weren't working. How much overall out of 52 symptoms, and we'll mention a few in just a moment, but the amount of improvement or the amount of reduction, whichever way you want to phrase it, you gave me a percentage before of how much better you feel now than you did last November or a year ago, January or July, or any time in the past year, 2, 3 years. How much better would you say you are now compared to then?
Yeah, over the course of the last few years, at my absolute worst, which literally was probably the end of 2022, beginning of 2023, I really did bottom out. I would say now I'm probably about 75% better overall, just with absolutely everything. There are a handful of symptoms that are just pretty much completely gone. If they crop up, they're really small and I barely notice them. They're not anything like the life-altering, earth-shattering symptoms that they were before.
And that 75% improvement, how long have you been feeling 75% improvement, or at least close to 75% improvement? How long has it been now?
Honestly, I would say really this far improved, probably the last 2 weeks or so. It's really kicked in and I have felt significantly better. Prior to that, I would say I was probably closer to 50% better. There were things that were better, but there was still some really significant issues. But it does feel like it's slowly coming back the other direction, and I'm starting to improve.
Yeah.
Yes.
So at 50% improvement, how long were you feeling that 50% improvement for?
Probably around February. I started to feel a little bit better. And then probably towards the end of February, it started to get a little bit better. I would say probably towards the end of February, I was about feeling like it was about 50%. There were still some really frightening things going on at that point. But again, it's really hard to notice when you get things that scream at you really loudly. You don't always immediately notice the things that aren't screaming at all anymore.
Right.
So
Right.
I think that I had a lot of improvement that I wasn't noticing until I sort of looked back at my own journals and notes and things and went, oh, well, that's gone. And I haven't actually thought about that one in a while, or, whatever. So about 50% since February.
50% for a couple of months. And there's
Sure, yeah.
and it hasn't gotten worse than 50% improvement.
No.
And
no,
now
it
it's even
hasn't.
better than it was. So
Yeah.
in the treatments that you had prior that you thought maybe they're making a difference in your life prior to ever meeting me, not the medical, but the alternative type of thing, because all the medical treatment or all the medical investigation left you like hopeless.
Nothing.
The whole nothing.
No, nothing.
But
And all they could do for me was painkillers and antidepressants and things like that. Nothing ever really helped with them.
And with the alternative therapy where you felt maybe a little better for a week and then it came right back where there was no difference. With this, at least we're having right now at this point in Care With You and For You, you have at least a couple of months of 50%. And back to the December experience where the mercury coming out of the brain with that one particular step, that symptom, that shaking and the tremoring with the body, with the head, with the tongue, after you took that, get that mercury out of the brain, did those symptoms from December, because we're talking almost 5 months, 4.5 months, let's say ago, those symptoms that you felt when the mercury came out of the brain, did those ever come back?
I would say the weird buzzing tremors in my head, those I don't recall ever coming back. I did have some other slight things like in my tongue and in my jaw that have come back. But again, looking at what we found on different testing, I think maybe we've had multiple things going on and the mercury was what was causing the vibrating. And I think the mercury probably was also flaring up other things that were going on. And once we got rid of that, everything kind of calmed down, although some things have stayed.
So we're actually looking back to even maybe in December is where you started to really notice the difference. And you said it before, but I'm repeating it now for people to hear that, is that it's been probably, whether it was 20 or 30% better at that point, because to you, the tremor in the head and the tongue and so on, it was really bad amongst everything else that you were at 52 symptoms. Those are only 2 of 52 or 3 of 52 symptoms. So to see that gone for another person, that's like the worst thing that they're dealing with. And for you, it was one of, they were all extremely horrible symptoms, but that has not really returned after that step. So, you really started to see the change there, and it hasn't gone backwards. But what we did find, and I'll reveal this to people right here on the call with you, is that there were certain things that seemed to be in your lifestyle that seemed to be okay or healthy or seemingly not stressful to you. But what I realized back in that visit, because the first time I saw you was September of 22, then I saw you December of 22, then I saw you again in, I think it was February of 23 and now April of 23. So it's 4 visits, but you're in the 4th protocol now. But I realized certain things that in your lifestyle that you thought were healthy and good for you, like those aromas, right? Just even peppermint was hurting you terribly. Even you smelling the certain organic, natural, chemical-free cleaners that you were using to clean your countertops were actually literally killing you. And they were triggering certain bugs, which we found a bunch of different types of Lyme, quote unquote, as they're called, co-infections. And once you started with that protocol, that is like really, you took a major leap forward. And now we're going to see an even greater. I hope for you that this protocol is going to bring you 100% relief of everything. And that's the goal, because if you could get better on one protocol, that's all that matters to me. I don't need 2, 3, 4, 5 visits. What's the point? There's nothing. It's just get you better and be able to tell everybody. But one of the things is, you told me that your internal shaking, when I saw you April 18th, 23, before we examined you, we talked about your symptoms, and you came in and you were happy and you were like, I feel a lot better now, and it's good. So the internal shaking, you told me, was pretty much gone. Yeah. You told me that your dizziness that you had all the time is now rare, and it was constant, right? It's now rare as ever. You told me that the sleep, which you've already said, sleep is a lot better. Your monthly cycles are a lot better. You had a lot of problems with that. Your weakness, that was a constant thing, that's gone, you said, right? No longer. The ear ringing or tinnitus, as it's called, that's the frequency is down greatly, right?
Yes.
Your anxiety that you had, is gone.
Yeah, I wouldn't say it's 100% gone, but I would say that's at least 95% better. Every once in a while, I'll get a little bit of flare up of that, but that right there is miraculous in itself because I've had chronic anxiety my entire life before any of the rest of this even started. And so for one of the early symptoms before I was diagnosed with Lyme, before all this happened in 2019, I can remember all of a sudden out of absolutely nowhere, sitting on the couch watching television with my husband on a relaxing Sunday afternoon, no stress, no nothing. And all of a sudden having a panic attack, which I'd never had before in my life, out of nowhere, no trigger, no nothing, which again, they say is a warning sign of Lyme. It's a symptom of Lyme. I had no idea at the time. All I knew is I'd never experienced it. It was absolutely terrifying. And I have not had any kind of a panic attack. I have not had any kind of severe anxiety, anything in months and months. Yeah, it's been a very long time.
Awesome. And that was definitely one of them when you came to me back in
Yeah.
September of last year.
Bad.
And that's been for how many years was anxiety? How many years would you say, going back if you can remember?
I would say going back to childhood, that it's been there to some extent, getting worse and worse as the years go on and stress becomes, more severe as you become an adult. But yeah, it's been there. It's been with me my entire life. It's been very, very severe.
It's going to be 100% gone.
Yeah.
That's awesome. You had nerve pain all over your body.
Yes.
You told me it was gone.
Yes. Yeah. I get little bitty flare-ups of that, maybe like in my feet, just a little bit here and there, but it's nothing I literally couldn't walk. It would hurt so badly and my feet would go numb and the tingling and the pins and needles and everything. And I almost 100% gone.
Awesome. And it will be 100%. You had constant, if I can say here, breast pain. Is that less frequent now?
It's better, not gone, but it is better and less frequent. Yeah.
You felt like you were being squeezed to death, like your body was being squeezed to death. Head, neck, face was being squeezed to death. Does your
arms,
body
legs, it was everywhere.
Arms, legs, everywhere. Do you still feel like you're being squeezed to death?
No, every once in a while, the only place I do still feel it occasionally is in my jaw. I will get a squeezing sensation still in my jaw, but a lot of the things we found in the last scan were in my jaw. So I expect that to go away, but all of the rest of it in my legs and arms specifically, to the point where it was hard to pick things up. I would drop them because I just felt like I was losing control, muscle function. And I haven't had that I can't even remember. It's been gone for a while now. I don't even think about it.
High five.
Yeah.
Awesome. You had shortness of breath that was every day, and it was pretty severe. The severity of the shortness of breath has decreased a pretty good amount.
Yeah, I would say probably 75 to 80%. I still will experience it on occasion. So it will crop back up and it will be there. But there were times before where I literally felt like I was suffocating, like I could not get a breath. I know there are some co-infections of Lyme as well that's associated with it. So I think we've sort of tackled a big portion of that, and it's much better. It would feel like I was hyperventilating because I couldn't get a breath. Yeah.
Wow. So that's horrible. So 75% reduced of severity, or 75%, and what about the frequency of it?
Both. Yeah, I would say both. Severity? Yeah.
So when I saw you on April 18th, because you already started your first week of your now 4th protocol, easy to follow at home. When I saw you April, and which we're only talking 2.5 weeks ago, when I saw you, you told me that the shortness of breath had gone down in severity 30%. And now we're already at 75% in 2 weeks more. Better. And you just started the first week of a new protocol.
And I want to say my day 2, I don't know, I have to look, but I think my day 2 protocol on this my day 2 remedy on this 4th protocol, I do believe was my lungs. So that would explain to me a lot of it, I think, because I think it was lungs, could have been, I can't remember, but either way, I just know that it has gotten better. I occasionally do have it crop back up, but it's much better than it was.
Oh, it's going to be gone 100%, because I know what we found is just amazing. I mean, again, just things that you thought were good for you were not good for you, of the natural type of essential oils and natural type of other things that you had brought into the exam that we figured out were actually literally hurting you. Even smelling something that had a rose smell was hurting you. Even just the vinegar and the soap thing that you're using was actually it was actually stimulating these bugs in your brain and your body. For us in here, it's about getting somebody better faster and seeing it as a final resolve of the whole condition to just being done. You don't need to come back and come back and come back. And also the symptoms don't have to return to your body, because once you get rid of the cause, it's gone. It's not like it's going to keep creeping back up. So, but there are people who don't understand that there could be, and some people do, but some people don't get this, is that there are layers. There could be multiple layers of multiple infections. Lyme disease, all those infections could be in the brain and other parts of the body at the same time. There could be mold in brain and other parts of the body at the same time. There could be multiple different viruses like influenza and Epstein-Barr and COVID and multiple things. There could be multiple vaccine chemicals that people had taken in the past. There could be multiple, there's pesticides, there's a lot of stuff going on in the body. Mercury and other heavy metals get in the body, sometimes toxic water people are drinking. Out of those 52 symptoms, and you know them, so overall, again, you're 75% better from this, and it's feeling like it's very consistent for you, and you're finally seeing the end of this 3+ year journey that you've been on. Is there anything, and again, I remember just a couple up to 3 months ago or so talking to you where you were like, I think I'm the one in a million. Maybe I'm the one who just can't get better. And I actually tried to get you in touch with a patient who it took us some time to heal her, help her heal herself. And she was also, she was somebody who called me every time and saw me every time crying to me, like, am I ever going to get out of this hell that she was living in, basically. Is there anything that you can tell people who have suffered, who do think it's too good to be true, that they can get out of the chronic pain, chronic illness, invisible illness, if I can say torture that they're suffering through? Is there anything that now you can tell them now that you're coming out on the other side of this whole journey?
Yeah, I would say, number one, don't give up, because it's really, really tempting to give up, because you really want to. At a certain point, you feel like, I felt like I had tried everything. There was nothing left. Every natural alternative therapy, nothing was too weird, nothing was too out there. I tried it all, and every single person promised me, this is it. This is going to be the thing. Oh, we've healed thousands. We've healed millions. This is going to be your thing. And I would think so for a while, and then it would go. And I was right back to where I was. So number one, don't give up. Number two, this particular method does feel weird. It does feel too good to be true. And I will say that as somebody who I thought was a very healthy person. I eat healthy. I, do all the stuff to take care of myself. I've got, a good quality air purifier and a good quality water purifier. I've never had any dental work. Like I have, I should be the one that's healthy, and still wasn't. Done all these treatments, had changed my diet, had done all the things everybody told me to do, and it still wasn't any better. Honestly, there are times when it's frustrating. I have to not really think back on it. If I can help it, I try not to, because it makes me angry to think about the fact that, I can't even tell you the amount of money that we poured into trying to get me better, just to get nowhere. Felt like all I was doing was just buying myself a little time, and that was not even good quality time. And now, had I known about this, had I done this from the beginning, I think I could have saved myself 3 years of hell and a great deal of financial pain, because it's definitely been, it's hard to explain, because like I say, by the time it got to you, I was so beaten down, and I had, my expectations were so low. It was hard to even disappoint me, because I was just not expecting much. And so I have been very pleasantly surprised to find that it actually has helped me, because, and it was never any offense to you. It was just one of those things, when everybody tells you the same spiel about how, oh, I've been doing this for 30 years and I've seen everybody get better. And then you're the one person, when they tell you, oh, I get 95% of my patients heal and never go back, and I'm the one that goes back. It's hard to believe that it's not just that there's something wrong with you. And so it's definitely been it's been a journey, but I'm thrilled, beyond thrilled, to say that I was wrong, and that this really has helped.
Yeah. that you were right for choosing to come here. You're wrong to think maybe it wouldn't be the thing
Yeah.
that would, but you were like others out there. You had to go through your trials and just find out. And this is, and I'm proud that we've done it with you and for you. We're doing it with you and for you. And hopefully this new protocol that you're on right now is going to just stop the whole situation that you're dealing with, or which is the rest of it, which is nowhere near what it was when you came to me. Again, I thank you for being generous of getting on this call. Thank you so much. And other people are going to thank you when they get to hear your story. Hope your husband is pretty happy he's got your back.
Oh, yeah.
Children are happy that your children have you back. And there is just a little bit more, but you're going to be fine. So again,
yeah, and I'm happy. I'll listen to your video because I don't even remember all 52.
Yeah.
I'm so far removed from it. I can't remember all of them now at this point. But yeah, there were a lot.
Yeah. I've got them all in front of me. I'm looking at them. And just one more request is that when you're done with this protocol, if we are at that 100% or even closer, that if we can just do a brief another interview with you and we can share with the world and just let them know, because it's all about helping everybody else get better. After helping you, it's helping them. So
more than happy to.
Awesome.